Welcome to Oasis Mental Health. I'm Dr. Marloes Verhoeven, and I'd like to tell you something about EMDR, or eye movement desensitization and reprocessing. That's a mouthful, and I would like to chunk it down to help you understand a little bit what EMDR is and how it might help you. The first two letters, E and M, stand for eye movement. Eye movements are crucial in this therapy approach, and it borrows heavily from REM sleep. When we are in our deep sleep or our dream sleep, our eyes make very rapid movements. So REM for REM sleep stands for rapid eye movement sleep. No one really understands why we have the rapid eye movements, but we do know that REM sleep is important for people to survive. In EMDR, we mimic the eye movements that we also make in our sleep during our dream phase. It is believed that it helps process through traumatic things or just through daily residue, both in our dreams and when we engage in EMDR therapy. I literally ask people to follow my fingers, so I might go like this, and I tell people, follow my fingers. Your eyes will then make complete movements from left to right as we process through traumatic material, and I'll get back to you a little bit about what that might be. We also use other bilateral stimulation. Bilateral stimulation basically means that we engage your brain halves in alternating ways. We do that with the eye movements, but we can also do it with tapping, so tactile stimulation, or auditory. So I have a headset that we can use and we hear alternating beeps, for example. By engaging brain halves in alternating forms, things that get stored in the brain in maladaptive ways and cause a lot of emotional disturbance now get a chance to get processed, so that you might still remember traumatic events but not have the emotional baggage that comes with it. Some people come in and wonder, when I do eye movements like this, is it kind of like hypnosis? Because when people think about clinical hypnosis, they kind of remember that pendulum swinging back and forth. And the answer to that is that it borrows a little bit from hypnosis, that's true, but there are a couple of very important differences between EMDR and hypnosis. The first important difference is that there are no suggestions from the therapist in EMDR. With hypnosis, a therapist will guide you through the process and will tell you what to do. In EMDR, there is no such thing. You are always in control. Your brain and nervous system has the ability to heal itself and will know where it needs to go in order to process through material that's got stuck in the brain. The therapist might guide you and facilitate and accommodate that, but there are no suggestions made on the therapist's part. You are in control. You do all the healing yourself. The second big difference between EMDR and hypnosis is that there is no altered consciousness. In fact, the bilateral stimulations, whether that's the eyes, the ears, or the tactile stimulations, they serve to keep you grounded in the here and now as we process through traumatic memories that can really take you back and almost like have a flashback type experience as if you're there. The eye movements or the tactile or the auditory stimulation will keep you firmly grounded in the here and now, and the EMDR therapist will make sure that you are too. So there's no loss of consciousness, and everything is in the present moment. As I said, the bilateral stimulation helps you access traumatic memories. This would be a good time to tell you a little bit about what trauma or traumatic memories might be. A lot of people come in and they think that trauma means that something greatly upsetting, immensely disturbing, and rather significant has happened, and very often that is the case. I see trauma in a little bit more of a broader definition. I think trauma is anything that can change the way we view ourselves, we view others, we view the world, and we view the future. Anything that can happen that alters our view of those four things can be traumatic. And it can be little things and it can be big things. And we all go through traumatic events. If you consider the definition like that, we all have traumatic events in our life. When people come in and are interested in EMDR, I help to explain them what traumatic events and what traumatic memories are and how EMDR can help them with that in the following way. I usually tell them, think of traumatic memories as a bubble in your brain. There's no actual bubble, but consider this to be almost like a time capsule. Something got frozen in time because something significant or something happened and changed the way you saw yourself or others or the world. And later events that happened after that kind of become associated with that event too, all the way to the present time, where if something triggers us today, it kind of follows that chain, that link down all the way to the bubble. And because the trigger is in the present moment, but it's linked to the past traumatic experience, now the past experience gets triggered, almost kind of gets opened up, and then everything we thought about ourselves, our emotions, our thoughts, our sense of self, the sense of safety and power and control, all of that gets activated in that moment. Some people come in and say, when I get triggered, I feel like I'm behaving again like I'm 9 years old. In a way, that's actually very true. And it can feel just as overwhelming and unsafe and powerless as if you were 9 years old. It's because that bubble got frozen in time and gets stored in your brain in an unintegrated way. And what EMDR does is it gently opens up that bubble. And instead of it allowing that bubble to stay frozen in your brain, EMDR and the bilateral stimulation helps you to integrate that piece of information throughout your brain and nervous system. In fact, EMDR can access trauma that happened before you could even speak, because our body holds memories too. Very often, trauma gets stored on the right-hand side of our brain, where we have no speech. Speech is on our left-hand side, and so we may not be able to talk about events, and yet we do re-experience them over and over again. By accessing that bubble, whether there's speech involved or not, it doesn't matter. Your brain will know how to access it, how to process through it with the help of EMDR, and how to heal from it. EMDR is one of the very few therapy modalities where actually brain scans have shown that changes in the brain take place as a result of EMDR. What this means for you is that you might have some memories, or you might have had some experience that continue to bother you to this day. You may be triggered, you may get flustered, you may experience a lot of anxiety or depression, and it may be related to something that happened to you maybe a month ago, maybe 20 years ago. It doesn't matter. That's that bubble in the brain that needs to be activated, that needs to be processed through. hope you found this to be somewhat informative. I know EMDR is a large subject to tackle in just a few minutes of video. I hope this helped. If you have any other questions, if you have concerns, or if you would like to talk about your very individual and unique situation, feel free to give us a call and we'd be happy to assist you. Thank you.